What's going on, guys? It's Humphrey, and today we're talking about leukemia. Leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Many types of leukemia exist. Some forms of leukemia are more common in children. Other forms of leukemia occur more often in adults. Leukemia usually involves the white blood cells. Your white blood cells are your protector cells. They normally grow and divide in an orderly manner as your body needs them. But in people with leukemia, the bone marrow produces an excessive amount of abnormal white blood cells which do not function properly. Treatment for leukemia can be complex depending on the type and some other factors, but there are strategies and resources that may help make your treatment successful. Some symptoms. Leukemia symptoms vary depending on the type of leukemia. Common leukemia signs and symptoms include fever or chills, persistent fatigue or weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, reoccurring nosebleeds, tiny red spots in your skin, excessive sweating, especially at night, bone pain or tenderness. Dan's bring back some memories. I'm sorry, dogs. And when to see a doctor, if you see any of these signs or you know anyone that has some of these, just contact your healthcare provider or their healthcare provider and get together and make a game plan on what you can do to either help ease it or hopefully cure it. I'm not totally sure if it's curable, but scientists don't understand the exact cause of leukemia. It seems to develop from a combination of genetics and environmental factors. How leukemia forms. In general, leukemia is thought to occur when some blood cells acquire changes or mutations in their genetic materials or DNA. A cell's DNA contain the instructions that tell the cell what to do. Normally, the DNA tells the cells to grow at a set rate and dies at the same time at a set time. In leukemia, the mutations tell the blood cells to continue growing and dividing. When this happens, the blood cell productions become out of control. Over time, these abnormal cells can crowd out healthy cells in the bone marrow, leading to fewer healthy white blood cells, red blood cells, and platelets, causing the signs and symptoms of leukemia. How leukemia is classified. Doctors classify leukemia based on its speed or of progression and the type of cells involved. The first type of classification is by how fast the leukemia progresses. There is acute leukemia. The abnormal blood cells are immature blood cells. They can't carry out their normal functions and they multiply rapidly, so the disease worsens quickly. Acute leukemia requires aggressive, timely treatment. Chronic leukemia. There are many types of chronic leukemia. Some produce too many cells and some cause too few cells to produce. Chronic leukemia involves more mature blood cells. These blood cells replicate or accumulate more slowly and can function normally for a period of time. Some forms of chronic leukemia initially produce no early symptoms and can go unnoticed or undiagnosed for years. The second type of classification is by type of white blood cell affected. Okay, I'm probably gonna butcher its name. I'm sorry, dogs. Lymphocytic leukemia. This type of leukemia affects the lymph node cells, which form lymph nodes or lymphatic tissue. Lymphatic tissue make up your immune system. And the second one is myelogenous leukemia. This type of leukemia affects the myeloid cells. Myeloid cells give rise to red blood cells, white blood cells, and platelet producing cells. These are the types. I'm gonna put them on the screen as well so you guys can kind of know what I'm talking about. There's all acute lymphocytic leukemia. This is the most common type of leukemia in young children. All can occur in adults. Acute myelogenous leukemia AML is a common type of leukemia. It occurs in children and adults. AML is the most common type of acute leukemia in adults. CLL, the most common chronic adult leukemia. You may feel well for years without needing treatment. CML, this type of leukemia mainly affects adults. A person with CML may have few or no symptoms for a month or year before entering a phase in which the leukemia cells grow more quickly. Other rarer types of leukemia exist, including hairy cell leukemia, and the other two I will post on the screen somewhere. Some risk factors: previous cancer treatments, genetic disorders, exposure to certain chemicals, smoking, and family history of leukemia. So I would probably have a more risk of getting it. This is one of the main ones that we unfortunately get. So unfortunately, but if you guys have any questions, comments, concerns, contact your healthcare provider. I hope you guys are staying safe. I love y'all. Thank you guys for crushing this channel. I love you guys so much. Every single one of you watching this, I love you guys. Stay safe. I will see you in the next video.